basically go through information that may help you to understand the aspect of the LPN. And I'm more than happy to take any questions that you may have during the presentation. So anytime, you could stop me anytime if you have any questions. And let's start. Second, there's way many new grads RNs in the country. So basically, every year in Canada, there are about 15,000 new grads. 15,000. So like 30 universities, about 15,000 new grads graduate from the universities, and they train in the Canadian system, and the hospitals have plenty of options other than taking international nurses. There were times where the international nurses were very popular right after COVID. Because of that happening, so many hospitals are shortage. And that's the prime time when the international nurses were able to get jobs in US and Canada. But doors been pretty slim these days. There's a gap in medical practice. Training is a big part. So healthcare system is different between the countries. And that's why they're hesitating to IENs, international nurses, takes between 6 to 10 months. And they're not able to work alone under the supervision and cost and amount of time. And so Canadian hospitals are slowly fading away from hiring the international nurses as RN. And let's talk about the strategic pathway. So the RN pathway is slim, and LPN is licensed practical nurse. Some of you guys think of it as the downgraded version of RNs, which is true. It's true. But do we look at the title, which is important? Pay is different. But what I want to do is envision like the next couple of years. You guys can still hold NCLEX license or RN license after you pass the NCLEX exam. You can do LPN RN at the same time, but LPN has a better chance because LPNs are well regarded in hospitals, long-term care centers, and also nursing homes. And there's super shortage right now. They need LPNs. So Canada is a fairly big country. There are 10, so Canada is comprised of 10 provinces and 3 territories. And from left to right, there are 10 provinces. And from top to bottom, so basically like top to bottom, every town there's a hospital. Every town there's a long-term care centers. Canada is also aging. I heard one of the doctors here said that there's a lot of geriatric centers in like Germany and other countries. Canada is one of them. The population is aging. But I think for nurses, for Jordanian nurses and other nurses, it's a great opportunity. Great opportunity to take the chance to be in Canada and work in any locations or any providers, long-term care centers, nursing homes, or community centers. If you start the process, so let's say you are RN, you have an NCLEX, you passed the NCLEX, you wanted to go to the United States, but now you're debating to go to Canada or United States. I think, and this is what I tell all the clients of mine, is if you wait for RN positions, it could be 2 months, 1 year, 2 years, more, and most of the people give up after that. And I believe there are opportunities that could be still open. So Canada is pretty open because nurses are always in demand. Canada relies on the foreign workers. And Canada relies on those workforces because Canada is mixed of all those nationalities in general. So let's look at this part here. You can think of RN as like a manager or a leader, like leadership. RN oversees several LPNs and also PCAs. And as I said, every year there's about 15,000 nurses graduate. For LPNs, there's about 4,000 to 5,000. When more LPNs are in demand, there's triple the number of RNs graduate every single year. And in fact, a lot of employers hire RNs as LPN. They pay $20,000, $30,000 more because there is no LPN who's able to take care of it. And we welcome nurses from overseas. It's just how we can navigate to the right pathway as LPN is a key step, and that's what I'm here for. So Canada, there is a variations between the cities and the small towns. So you probably heard of like Toronto, Vancouver, Montreal, Calgary, and a few other big cities. There's a lot of variations. All of those nurses, they want to go to big cities because they get paid well. Whereas rural, like smaller cities, they're not. They're still getting pretty good pay, but I guess there's more to do in the bigger cities. And I'm not saying you need to like compromise that for for like the whole time, or like forever. But what I'm trying to say is that there are going to be more opportunities when there's smaller cities are. And once you become a permanent resident, you'll be free. You can go to RN, you can do an NP, or you can go to master's. That's your choice. But the shortage prevails in the smaller towns. And also, the Canadian, so the good thing about Canadian, the program is that it's always linked with immigration. It's not, for US, you get like H-1B visa or something. It doesn't guarantee, or it doesn't at least assure the green card. After 3 years, 5 years, Dr. Sun is lucky enough to get the green card here, but not everyone is able to get it, especially at these times. But Canada, the work permit and the permanent residency pathway is interconnected, which is going to be a great benefit, which I'm going to talk about. So I talk about this one a little bit. So when it comes to RN shortage, registered nurse shortage, it's subtle because there's a lot of new grads getting a job and make their way up. So for international nurses, there can be positions, but the opportunities are not going to be there compared to LPNs, and it's very competitive. For LPNs, so we've been filling pretty good number of positions for the last couple of years for my clients, and it's easy because there's no other people that want to take the jobs. And Canada has shifted that people want to take like part-time shifts, not the full-time. But all the foreign workers, they want the full-time jobs. They want more hours. Canadians, they don't. They want like 2 shifts, like 24 hours, maybe 36 hours, but not more than that. So there are going to be demands at the healthcare providers, as always. Any questions? Pretty clear? Are we good? All right. Okay. Nice. So I guess big picture. The first step is you come to Canada, you enter. There are steps before you entering into the country, but the big picture is you go through the pathway or process, pass the exam, which is pretty easy because you guys are all nurses, right? So I'm sure you guys are capable of passing all the exams and stuff. You work as LPN, and I advise that there is a gap. Gap refers to the Canadian experience. It's critical. Exposure to Canadian experience will make a big difference in the future. So work as LPN, that means you are holding a work permit. And then, all right, but there's more than that, which I'm going to cover in the next slides. I'm sure Jordanians complete 4-year nursing degrees, right? Okay. So, and also most of you study English, right? Okay. So that itself qualifies to get a license without the bridging program. So the bridging program, so some nationalities, their education is not considered equivalent to Canadian standards. That means you might have to take some courses before you can take become RN. But for Jordanians, the education is well guarded. That means you don't need to take the additional courses to become an RN. I talked about this already, so I'm going to pass this one. So there are a few things that you will take, and you may have to keep up for timing. It's faster. You can't. So people are asking, how about RN opportunities? Can you wait? Yes, you can wait. But in terms of the timeline, do you think you can beat it? No, you cannot beat this timeline because you don't work on the supply and demands. And when demands are higher, the supply is there, then we all can fill the supply without the problems. I should have put this into more like wording here. So here's PNPs, right? PNPs and ANP. So PNP is the acronym for Provincial Nomination Program. So every province has their own provincial nomination program. And ANP is it's for the Atlantic Immigration Program. So there are 4 Atlantic provinces in Canada: Nova Scotia, New Brunswick, Prince Edward Island, and Newfoundland and Labrador. They're all fast. Nurses, it's one of the essential occupations in the country. That means there's doctors, pharmacists, physiotherapists, construction nurses. You name all those medical side and construction, that's gonna be essential and fast. And how fast, that all depends on the countries, and it depends on your family size, your documentation, but generally speaking, it's much faster than, like, for example, cooks, hospitality, like mechanical side. Anything that's not relevant to construction or healthcare is faster. And because it's so essential, you are most likely be getting a good amount of support from the employers. So training-wise, onboarding, promotion, advancement, that's going to be pretty much there for you guys to access. This is just the analysis for you guys. How much of money, that's like the, so bi-weekly payments. So bi-weekly for 12 weeks, 30 payments annually. So 55,000 is the lower side of it, but Canada makes a lot of tax. You guys have to pay a lot of tax. I pay a lot of tax, and that's unfortunate. But as a Canadian or as a worker in Canada, you have to make tax. Unless you're self-employed or make your own business, you cannot get away with the tax portion. And just for your analysis, because some people make more than that, less than that, I'm just giving you some insights how this salary will be calculated towards your income. And when you look at here, most of you are married. Are you guys married? Single. Single? Yeah. Lucky guys. I mean, like, you guys are married, right? You're married. Single? Are you single? You're single too? There's a group of singles today. Singles? The slide that we'll talk about is, you said you're married, right? Your husband, I don't know what he's doing, but he's coming with you, right? Yeah, of course. Then he's able to work. So nurses, PNP program, the benefit is that you're able to include your husband for the open work permit. He can work for any companies, even 2 companies. So if you want to make your husband work like 18 hours, you can do that. There is no restriction. Yes. So singles, you can't, but for the married spouses, you're able to make more for the family, and in general, you'll be able to save more as a couple. Right? Yes. And for the healthcare coverage, so Canada, is pretty good with the healthcare. So you're going to be covered for the provincial healthcare and also company insurance. So provincial healthcare will cover like doctor visit, pharmacist, prescription, everything. The company benefits will cover like private services. Like I talked to you a little bit. There's a process. So first step is you have to start your evaluation. Evaluation means you have to get your documentation together and submit to one of the evaluating organizations like World Education Service, like WES, or International something, ICES or IQAS or MIIE. So there are multiple organizations that handles evaluation, and that will take about between 4 to 8, depends on the organization and volumes. But generally between 4 to 8 weeks would be a good batch. And once you start this credential assessment, you will be able to start the LPN license application. The documents are pretty similar. Some may be more towards the employment side and your license verification, but the licensing for the credentials and licensing application are pretty similar. And once that is being progressed, then what you need to work on is the exam preparation. So some of you have done NCLEX, right? NCLEX is hard. LPN is relatively easier, but people fails. The reason is you guys are all working as RNs, right? Registered nurses. Scope of RNs in Jordan, Lebanon, Saudi, Canada are pretty similar. So you guys are all used to RNs. But if you try to take LPN exam, the scope is completely different. That's where people fail. Without preparation, I see people fail big time. You're gonna lose time, you're gonna lose money, and you're gonna be anxious, put more time to study. There's all smart people here, but it's not, people fail not because they're not smart, it's because there is difference in scope. So preparation is extremely important. Right, Mr. Army? Yes. And once you pass the exam, then you'll be able to get a full license. So full license, with a full license, we're going to start the requirements, work permits, provision nomination application, and the permanent residency.
So the West, I'll just give you an example as West. West will take about 48 weeks. And CLPNL, that's Canadian Licensed Practical Nurse of Newfoundland. It's pretty long.
College, I'm sorry. Yes, it's college. Sorry. College. Oh, it's okay. I say they are. I don't need a link. It could be 8 to 12. It could be shorter. It could be longer. If anybody has a license in Canada already, super quick, like 2 weeks. But if you have never done it, it all depends how fast the documentation is transmitted to the college, to this licensing body. So 8 to 12 is a pretty good estimate. One of our candidates from Egypt, he did it within 8, 9. He's from Egypt. So that's what I got. So accreditation, verification. First step, we talk about it. Education, examination. Preparation is everything, as you guys have done the NCLEX or any other exams. Program is your choice if you want to use our platform or on your own. It's totally up to you. But at the end of the day, I want you guys to pass on the first attempt, not second, because you're going to lose money, lose time, and there's a big loss. Big scope is that you pass on the first attempt, okay? So the next phase, employment match, job offer. This is where the questions. Ladies, questions? You guys have any questions? Do you have any questions?
No. I'm just thinking.
Oh, okay.
Sorry.
No, that's okay. Gentlemen, questions? Very clear? Yeah. See? Who's the one that question? I'm prepared, right? Very prepared. So there's going to be exciting part here. The employment match, which means we organize the employment with the potential providers. And job offer, and once we have a job offer, we're going to start the nomination. In Newfoundland, nomination takes 2 weeks. Pretty quick, right? And there are cases that take a week, maybe 3 days, 3 weeks, but on average, about 2 weeks. I put 1 to 2 months. You know why? Because I want to be a little more conservative. I want to give enough time to get this. Sometimes, if I say 2 weeks, people expect that this will be done in 2 weeks, and coming after me, that, oh, James, why is not done? So, on average, I said 2 weeks, but you can take up to 1 to 2 months. And after provisional nomination, we're going to work on the work of it. Work on application is the key for you to get the visa. And permanent residency is around 12 to 15, could take 18 months. So this is all depending on the family size. Single, good thing about single here, it's fast. Single is going to be fast. My PR back in 2011 was done in 3 months. 3 months, never happens now, but 12 to 15 months is a really good time. It's really good timeline, and plus minus. Any questions? Any questions? No questions? Are we good?
Yeah, about when we arrive in Canada.
Yeah.
So 12 to 15 months to get like a green card,
Yeah.
Just
Maybe less, 9 months for the Jordanian. Jordanian can get faster to Canada.
Working on it in Egypt, and right last week it was 181 weeks. So you're going to be entering as a work permit holder, but that's not going to stop you and your family to apply for the permanent residence. Are we clear?
Can I ask if there is something يعني applying for child incoming يعني if I'm married I will take my maybe something يعني there is maybe يعني it will be cancelled for holiday يعني there's problem any problem for holiday maybe cancel
So you're gonna what you're saying is you apply all together and you make them by yourself.
No, what يعني I agree what the
It could be lawful. It could be lawful because Canada checks security, police background, and medical. So more people in the family household takes more time to do the background check, right? That's why it's taking longer than the single guy. You can only one thing is the background, but you have to have your husband yourself, so it's not taking long. Okay. So here's the case. So give you one sample case. A guy from Egypt. He's RN. He finished his university from the Cairo University. He's RN from Egypt. He chose he chose on the LPN pathway. He passed the LPN exam on the first attempt. Super smart. Work permit is supposed to be taking average 181. It was done in 18 weeks. So essential occupations are processed much quicker. So Jordan is now 24, but are we going to expect it to take 24 weeks? I don't think so. It'll be shorter than 24 because essential occupations are prioritized by the government. Okay. So validation.
Is it okay? Okay, good. All right. So validation took some time, but it's not too bad. 14 weeks is not bad. And LPN, 4 weeks is because you have to put the exam and pass the exam. The result comes out after 2 weeks. And once you pass the LPN exam, you will be getting the license. The LPN license, he received the offer within a month. And nomination approved in 2 weeks. Actually, it's 2 weeks. It's pretty quick. And the work is not processed anymore. It's not processed. Sorry, it's approved. It's approved within 18 weeks, and PR is being processed. So he's single guy, pretty quick, and I'm expecting that by end of this year, his PR will be completed. So when people like that you know or you search, like Dr. Sam, Rami, or James, you're lying to us. He's taking 181 weeks. How is it possible? I would say, please don't panic. The data on the government website sometimes is not accurate, and sometimes it's not reflecting the entire application at best. But how it would help you feel comfortable to think this way. Once you become a permanent resident, whether it takes 12 months or 15 months, as soon as you become a permanent resident, you can work as RN. Yes?
You have another question? Yeah.
I'm sitting right now, okay?
Good.
Go ahead and make the process of it, and then I can do the related process.
So that all depends. So from the immigration expert perspective, if you're married during the process, then your application may be scrutinized. The reason is they have to look at how long this relationship has been. If the relationship just started, like a month,
they got married. Of course, it all depends on the culture and all that. But we have to have a reasonable grounds when we add your, spouse. But let's say if you married after you become a permanent resident, you can sponsor. I'll help with that. Yeah. Okay. I can help with the sponsorship too, so it's not an issue. Any other questions?
Yes, I have. We felt about this exam. How many months or weeks we can take this exam?
Could you say again, please?
If she failed the exam, which country?
When she can retake it?
Yeah.
2 months.
2 months.
2 months. Every 2 months there is an LP. September and November. Don't fail. While you're thinking about failing the exam,
How the student will get the material for this exam?
we provide.
You will?
Yes.
Okay. This is the target one of just pass or fail.
It's a pass or fail, but there's a number of criteria.
You have to get correctly question.
Correct.
Yes, it will be conducted here in the Jordan, or you have a special center in the world like technique.
You can take it home online. Is your proctor? Okay. Nice. Yeah. Bring me 1,000 people.
How many attempts the student he needs to get pass? How many trails he can?
Attempts?
Yes.
If you fail 4 times, you have to wait 1 year. But they're gonna pass. We're gonna make them pass.
He's approved. We redacted some of the information, but he's approved Cairo and approved recently. It's approval letter. This is basically you to bring with you and with the visa. And this is a sample license. So he had the conditional license, now he has full license. But this is a license granted by the CLP-NL. And you have to renew it every year. So, any questions? Yes.
I have 2 questions.
Yes.
First one, I want to ask if your company have any plans in the future, so which you or your company can get the RN nurses instead of FBN nurses, so we can get a contract with RN, not RN Canada.
There could be an opportunity, and I want to do that. That's not like, it's better for me. It's better for me. Because I work with both the applicants and the companies, I have to look at both sides. And as much as I want to help all the nurses here get the RN positions, sometimes reality it's hard. Because the companies, they do not hire. But if I have any opportunities for sure, I'll keep you guys posted, okay?
This is like additional information because I want to help you envision the license is not everything. So Canada will open up a lot of doors for you. Permanent residency after like 2.5 to 3 years, guess what? You can apply for Canadian citizenship. So I don't want to get too much into the immigration regulations, but there has to be a physical presence in Canada, which is 1,095 days, and the previous 1 year of residency, you can count half of it. That's why I'm saying you could go up to 2.5 years of residency after becoming a permanent resident will be counted towards your Canadian citizenship. I have a lot of nurses and medical professionals going to Australia, New Zealand, UK, United States,
whenever they want. Much better compensation package, much better weather too. Canada has like 4 or 5 months of snow, so it's cold. So they go out to different countries, and I guess one of the privilege having a Canadian citizenship is that you're not going to have mobility issues. Sometimes, like, you have to get a visa, you have to get something before you can leave the country and go to somewhere else. But Canadian passport will remove that conditions because you can travel a lot of countries, 170 countries. So that's going to be something that U.S. work permit will not provide. U.S. green card doesn't even provide such benefits if you're not a U.S. citizen yet. U.S. green card help you live in the United States, but mobility will still be the same. But having a Canadian citizenship will change that dynamics, and that's something that that I want you guys to think about it. The end here is international educated nurse, which is what you are right now. And you're gonna go through all the credentialing, license, LPN in Canada, permanent resident, and Canadian citizen. That's gonna happen in the next 5 years. So singles, before you reach 30, you can reach that. I did that, so you guys can do that. I used to be an engineer, and I did that, so nurses, you guys have a higher chance of getting to that, okay? Do I have the next slides? So this is, yeah. So I think it's, yeah. I mean, that's everything that I have. I'll take some questions before we're gonna connect with Hassan. Hassan is the example that I shared. He speaks Arabic, and he will share some experience that he has going through this process with us. So, Rami, is it?
Yeah.
Okay.
We will start. Mr. Hassan start the process. Hello. Mr. Hassan already started the process, and he passed in the CBN Army in the August. After he passed in the CBN Army, he already his file started in October, I think. And right now, in February, his visa already done, and he will travel to Canada, inshallah, the end of this month, February, inshallah. Mr. Hassan will join us right now, and he will talk about his experience with global health. What about the course? What about the preparation period with Mr.